what are the pros and cons of ophthalmology as a branch?
Many of the branches may be giving you more money, but guys, then you don't have the time to spend with it.
Despite having good work-life balance, why not ophthalmology? Is it because the field is saturated?
One thing is, everybody is not able to do it.
And between MS Ophthal and DNB Ophthal, is there any difference?
DNB mein, what are the differences? They are done in hospitals. That is the reason that passing percentage of DNB people is much less than the MS.
Now, what can you say about the business prospects in the branch of Ophthal?
If I talk about the IOLs, the people who are dealing with it are earning like anything because...
Ma'am, is ophthalmology a toxic branch?
Then it becomes toxic for me.
What would be your strategy to crack NEET PG in the very first attempt? And how much does an ophthalmologist earn in India? There is a famous quote, make your vision so clear so that your fear becomes irrelevant. Today, we have a protector of that vision on our show. Yes, we are interviewing an ophthalmologist. She has been a gold medalist both in her undergraduate and postgraduate. She has done her whole education from Aligarh Muslim University and she has been educator for last 15 years and more. She is a very dear friend, has been a mentor to more than 1,000-2,000 students and an amazing person. We are interviewing Dr. Niha Aggarwal today and we are going to talk about how much can an ophthalmologist earn? How much is the scope of this field? What are the pros and cons of becoming an ophthalmologist? Is there toxicity in this field? What are the super specialization possible in this field? And what is the perfect NEET PG strategy to crack it in the very first attempt? To listen about all these topics, watch the coming podcast. And now let's put our hands together and let's welcome Dr. Niha Aggarwal. Ma'am, welcome to our show. Thank you so much for taking out time for this conversation.
Thank you, my pleasure.
So, ma'am, you have been an integral part of DBMCI for like so many years. I can't even count now. You have been a very dear friend. So, before we start on for your journey as an educator, as an ophthalmologist, and so many things that you are today, I would request you to tell us about your initial journey, the beginning of Dr. Niha Aggarwal.
Yeah, so this is a very emotional part of me. Actually, my parents always wanted to me as a elder daughter and the first child. They were very passionate about me and they wanted me to be a doctor. And as I joined and I started with the preparation, I felt that not only it's their dream, I am also going towards my destiny.
Great, ma'am. Guys, this is the part that I have skipped in the intro also. So, ma'am is not just an MD ophthalmology. Ma'am is also an MD OBGYN. She is a dual MD person. So, ma'am, what made that decision of doing two MDs? People are not able to do even one and you have managed to do two. And also that too from some very prestigious institutes of our country. So, what made you take this decision?
Right, so I think destiny always has decided two things for me at a time. I'm a person who is always doing multitasking. Even when I started my preparation, I was there with PCB and my father told me to take meds and he said ki you can do it, then why not to do it? You can even sit for the MBBS paper, entrance and BTech, and I was doing there literally, I'm running here and there for the classes, and after 6 months I said no, I won't do it now. You have to take the decision at one point of time. So I told my father to please discontinue the maths. But I was not knowing that actually this too will continue with me with the entire life. And when I did my OBG, it was very good. And even I was a gold medalist there too. But I thought that I am not able to do as many things. There was a motivator inside me. There was an author inside me. There was a motivational speaker inside me. And they were not finding time to do all these things. And then suddenly I encountered ophthalmology, which actually gave me that job satisfaction with medical field, with the surgical satisfaction, and also a very rewarding branch. You are very happy when you give vision to the patient's eye.
Ma'am, if I ask you that, what were the 3 sacrifices you made in your life to actually become the success that you are today?
Right. So success is never without sacrifice. And behind a successful person, I would say it is not only his or her sacrifice, it is the sacrifice of the family. So I had to do so much of the studies, doing so much of work. I could not spare any time for my family. So that was not only a sacrifice for me, but also a sacrifice from them. I cannot relate to any of the family event. Even, when it was a family inauguration in my auntie's house, I was not there. I have not been to her house even today. There are so many years. So, every time, at every step, we are sacrificing for this day.
True, ma'am. Ma'am, you are a practicing ophthalmologist. And today you are a full-time faculty. So what made you choose being an educator as your full-time job?
Right. So when I was a practicing consultant, I was very happy to give vision. I means there is nothing better than vision in your life. So it was very rewarding. But at the same time, when I saw these students who are actually working day and night, I thought that I can actually help thousands of people to achieve their goals, their dreams. And it was one versus thousands. When I am treating patients, it's only my satisfaction. And when I am helping these students to achieve their goals, I can see thousands and millions of goals being achieved at one time. I can be happy for them. I can be sad for them. I'm motivating them. So that is ultimate feeling.
That's great to know. So, ma'am, as you know, the NEET PG counseling is going on. So, I think the students are always looking up to more advices regarding ophthalmology as a branch and who to guide them, better than you. So, ma'am, I'll ask you a simple question. What are the pros and cons of ophthalmology as a branch?
So, as an ophthalmologist, I see very less cons in it, but still, because we have to deal with it. So, pros, first of all, whenever you have to balance your personal life and professional life, there is nothing like ophthalmology. You have finances, you have work, you have patients, you have medical work, you have surgical. Many people and many of my colleagues are not doing surgery. They are happy even with the refraction practice. So you can have money and you have the time also to spend the money. Many of the branches may be giving you more money, but guys, and you don't have the time to spend with it. Secondly, there's no problem with the patients. Cataract is very common, glaucoma, and as a budding, developing country, we have more and more diabetes and hypertension. So retinopathy is related to it. So that means you don't have to search for the patients. Patient exposure is too much here. You can do it. Then number 3, it's very, very rewarding. When you are giving vision to the patient, obviously it will give you a lot of job satisfaction. But yes, you require a lot of investment. Now, though it's again controversial thing, I say that whenever you place a slit lamp, Ophthal OPD is there. So you have a torch, you have a slit lamp, Ophthal OPD you can start. But the thing is that today's life, they always want to start from here. So yes, if you want to start from here, then you require the investments. So that is a major cons. Otherwise, I always tell my students also that being an ophthalmologist, you are a good student and you are a good spouse. So if you want and you are looking for a spouse, look for ophthalmologist. And if you want to be a good one, you can be ophthalmologist.
Ma'am, do you think this branch is not as glamorized as surgery or medicine? Basically, fewer medical aspirants actually choose this branch as their end goal. They are normally tend to go towards medicine, surgery, derma, radio, ortho. But despite having good work-life balance, why not ophthalmology? Is it because the field is saturated?
See, saturation is again a very difficult word. We have saturation in every field. Now, you are saying that everybody is going behind medicine and radio or surgery. So that means they are even saturated more than the ophthalmology. One thing is that it's a fine surgery and everybody is not able to do it. So let's see that you require certain levels of skills, and that is why learning graph is little higher than the medicine or the general surgery. Orthopedics, they are the crude surgeries. We people are working on the level of the wrist joint. So if you are not very, very fine in doing the surgeries, if you are not very good at your microscopes, so many people are actually afraid of this long learning curve. Plus, if you see ophthalmology, you have to be a super specialist. So there is a thing in their mind that when you take ophthalmology, it's very important and necessary to go for the super specialization, while it is not so. Even for medicine and general surgery also, now you have to go for the super specializations. Then another thing is that they always go for the investments, that I'll require a huge setup. But now we have so many corporate chains. So guys, if you do not have investments initially, you can always start doing the job. They are giving you decent salary, and once you have earned handsomely, then also you can go with your own investments and your own setups.
True, ma'am. Ma'am, what are the super specialization options in the field of ophthalmology?
So like any other branch, we have all the things. We have anterior segment, posterior segment. You can go for the retina super specializations. Lasers are very, very upcoming. And we have the plastic surgeries. We have the cornea super specialization. So it's your choice. Basically, most of the people go according to their thesis topic also. What was your thesis topic? Usually that becomes the topic of your choice, the subject of your choice. But even afterwards also you can change. You always have that possibility. Suppose I have done the specialization in retina, but now I felt that there is a saturation there and I don't want to continue with the retina. You can do super specialization with corneoplasties. We have eye banking. Eye banking is something that can even take you towards the WHO. You can do something better for your country also if you have that kind of perspective, and you can decide accordingly.
Ma'am, between MS Ophthal and DNB Ophthal, do you count them as equivalent, or is there any difference?
Nowadays, theoretically they are same, but practically, yes, there are little differences between the two. Earlier, there was lot of difference. Now, that difference is slowly decreasing and decreasing. MS is MS. What to say about it? Like DNB. DNB mein, what are the differences? They are done in hospitals, and hospitals mein academics obviously will not be that good as in medical colleges. Medical colleges mein we have regular full-time consultants who are dedicatedly taking the lectures, seminars. Academics have to be very, very good. But when you are going for the DNB, it is in hospitals which are super crowded and they are always busy with the patients. But like I say, if it is your choice, you are dedicated, you can maintain your academics at your level. But yes, academics is obviously a difference. Second thing is that when you go to the passing percentage, there has to be a difference, because medical colleges may the professors who are taking your examination know you. They have a rapport with you. They have a frequency with you. Even if you are not answering very well on that day, they know you. They'll judge you. But DNB may you are an alien, you have come up from somewhere, you do not know them, so they do not know actually about your skills in academics, and your passing will depend only what you are doing that day, and that is the reason that passing percentage of DNB people is much less than the MS.
Thank you, ma'am. So, ma'am, can you tell us like top 5 colleges for MS Ophthal in our country?
So we have the best, the AIMS Delhi, then we can go for the Safdarjung Delhi, CMC Vellore is there, PGI Chandigarh, and we have SG PGI Lucknow.
Great, ma'am. Thank you so much. Now, ma'am, can you help us with the 5 best institutes for DNB in ophthalmology?
Right, so we have the Shankar Nethralaya, we have Arvind Eye Hospital, St. Stephen's Delhi is very good, even Hindu Rao Delhi is very good, and then we have the LV Prasad.
Ma'am, what can you say about the business prospects in the branch of Ophthal?
So these surgeries are using the things which are very high in terms of the revenue generation. If I talk about the IOLs, the people who are dealing with it are earning like anything, because it is the thing which they require for their cataract surgery and they want to spend. So you don't have to motivate much for them. And even the surgeries, everybody wants to go for the sutureless surgeries. You don't have to convince them. They know already that they are better. They don't have to get admitted for a long. So that means the rehabilitation is very fast. Number of surgeries that you can do in Ophthal in a week are much more than any other surgery. You don't require any patient burden. We just keep the patient for 4 hours one day before. You do the all workup. You send the patient. Patient will come in the morning like any other place. He will go for the surgery, and in the evening he can be sitting in a cafe having a coffee. So that way, I think it's a very, very high on revenue generating.
Ma'am, normally after SR ship, basically, how much time does it take for someone to actually just establish their own practice, and how much investment does it take?
Right. So our consultants used to say that the best time to start the practice is today. Even if you, take 100 years and you start thinking that when I'll be, fully confident, then I'll start the surgery and the practice, that day will never come. So just after you have completed the SRship and you are not planning to do any other fellowship, you are ready to start your practice. And with the practice itself, you can, have a learning curve, and slowly and gradually you can be practicing more. We all have that opportunity to experience more learning. We can attend the journals, we can go for the conferences, workshops are there. And it's not that you are not learning and you cannot learn even when you have started with the practice. Now, how much investment? So investment minimum, if you have 20 lakhs, then also you can start with your Ophtha practice. In the beginning, you can have a good OPD setup and you can rent out the OT from your friends. So even if you don't have crores, no problem, because if other friend is having a OT, he will not be doing the OT all the 7 days. So I always say, even if he's doing OT twice a week, which is more than enough, then you have 5 days. You can rent out the OT from him. You can use his OT with the nominal charges, and slowly and gradually, when you have earned your crores, you can start your OT setup there.
How much investment does it take to establish an OT?
OT may, yes, you require like 50L plus, because all the machines are costly and the microscopes are costly, especially if I talk about the phacoemulsification, then it can touch up even 80-90 lakhs too.
Ma'am, what about a business, for example, if you have to do LASIK surgery? We can see vision, we can see center for sight. Not that big, of course, but that kind of business at a smaller level. How much investment does it take there?
It requires a decent amount of investment, and that is the reason most of the LASIK surgeries that we are having is in corporates. Very few practitioners are actually starting with their own setup. Now, another reason is that the number of patients that we are having, the candidates for the LASIK, are not that much that you are able to create the effective revenue if you are doing it at your personal level. The prerequisites that you are requiring for it is again a major limiting factor, and most of the people who want to go for the refractive surgery just for the cosmesis is between 20 to 30 years of age. So I don't think that it is very advisable to go for these kind of surgeries at the personal level. Yes, if you are having a specialty hospital, you are earning from other things, then you can put up your investment here also, and in the long run, turnover will give you the money, but as a whole, only LASIK surgery won't be very useful.
What are the opportunities for an ophthalmologist outside India?
So outside India, opportunities are even better than India. The reason is that there they are not giving these fine surgeries. They are not even, giving Indians to do the PG in ophthalmology. There they are getting in the medical branches because it's a fine surgery. And even if you have done the ophthalmology from here, the patients won't allow you to touch there. But if you have done ophthalmology from there and you are practicing, then you are earning like anything. Those people are more sophisticated and they are actually, valuing surgery, ophthalmology, surgery even more than general surgery and medicine. And if you will see that those people who are preparing for MLE, you will be seeing them as a medical You'll be seeing them as a practicing physicians there. They are hardly doing surgeries, and even if they are doing surgeries, they are not doing ophthalmology as a surgery. There we are doing psychiatry and medicine. You can be a dermatologist there, but it's very, very, prestigious to be an ophthalmologist outside. But once you get that opportunity, then you are earning like anything.
So I'm coming to the favorite question of our podcast. Ma'am, how much does an ophthalmologist earn in India as a fresher after post-graduation, as a mid-experienced doctor and as a senior doctor?
So if I start with the SIship, as a newcomer, you can be earning something between 2 to 3. And after the 10 years, when you have already done with the practice, we can be touching the 10 lakhs. But once you have built up your name and you are the budding ophthalmologist, then you can touch up even 20 to 30. And I know people who are earning near 50 also, who are working in the finest of the institute. So they are doing this part-time, their practice too, and they are getting a decent salary from the institute.
Ma'am, are the payments same in government and corporate? And if there's a difference, what is the difference?
Yeah, so government will always give you more money in the beginning. So if you compare the starting salaries of the corporate and the government officials, then you will see it's more in the this government setup. But as we go higher, they have become saturated. You will see that the government people are not increasing that much, and slowly and gradually, when you are going to the higher posts in the corporates, because you are getting the cuts also, that will make a major difference. And when you are working only on the salary, you will be very near to your government job people. But if you are only in your corporates and you are getting the cut, so patient is coming by your name, he is knowing you, then they will be giving you handsomely.
Ma'am, let's talk about NEET PG. So, do you think my first question is going to be very easy, and I think this is the question which is troubling every new JR right now. Ma'am, is ophthalmology a toxic branch
So,
during residency, especially?
see, what is the definition of toxic? First of all, if I want to learn something and I am not able to, I am not being provided the opportunity, then it becomes toxic for me. So in the surgical branches, you should be always knowing that you require great degree of patience, and learning does not mean just cutting. Learning does not mean that you are watching along with your consultant. Before going to that stage also, you have to learn so many things, and if the consultant feels that you have covered all those things, you know those things, then he will definitely ask you to wash off. Now, nowadays, I think that the students are there who don't have the patience, and from the first day, they want that they should be standing besides their SR, besides their consultant, and scrubbing and washing. And that is why they are feeling that it is a toxic branch. Yes, I will agree that it's a fine branch and it consists of fine surgery. So they will require time. Like what we are doing is the surgery on a real patient. They are not guinea pigs as in physiology labs. So until and unless you have that finest of the precision, they cannot offer the patient to you. So you have to develop interest. You will have to first practice. We are having the cotton balls. We are having even the tomatoes. We used to do the suturing first. And once you are putting your efforts, then nobody can actually stop you from doing the surgeries.
So my next question is built on this only. So basically, to become a successful ophthalmologist, what kind of person should a student be to actually be successful in this branch?
Yes, so you have asked a favorite question. I always tell this to my students in the class also, that if you are very impatient, please don't join ophthalmology. You have to be very, very gentle and firm. That two things. I always say that if you are adamant that you want to take surgery and you are impatient, go for orthopedics, go for general surgery, go for this OBG. You can do cesarean impatiently, you can put a screw impatiently, because you are having those large instruments. But once you are there with ophthalmology, see, working space is very less, and guys knows that the eyeball is just 23 mm, and you have to work at a depth of anterior chamber that is 2 to 3 mm. So you have to be very, very precise and patient at that time. Second, the learning curve, obviously surgical branch hai, so it is higher, and it's a fine surgery, so it is even a little more higher. So if you are a person who wants to study for a limited time and then I have to do the clinical practice, again don't go for ophthalmology, because it will require a longer learning curve than your colleagues. Then you can go with the terminal branches. Then number 3, if you have tremors, then I openly say don't go for ophthalmology. You can do wonderfully well in 18 other subjects. And another thing, if you don't have tremors but your parents have tremors, then also don't take ophthalmology, because tremors will come after 30 to 35 years of age, and that time, my friend, you won't go back and you will change your thing. And fine tremors means you cannot do surgery. So if you are ready to practice only the medical ophthalmology, then it's okay. But I think the USP of ophthalmology is the surgery, then also you should always avoid. Then a very important thing, the color vision. So if you have the total blue color blindness, and even if you are able to escape the Ishihara color charts, then also you should not go for ophthalmology, because that will be standing in front of you as your restriction in any point of your time. That time again you cannot go back and change your branch.
Thank you, ma'am. The color blindness was my next question, but I'm glad that you answered that. So, ma'am, what would your advice be to a new JR1 entering ophthalmology residency?
So first of all, I will say welcome to the ophthalmology. You are colleague now, and beta, you have to study too much. Whenever you are joining the residency, first you should be ready to learn. You should have the big ears to listen everything in your department which is going on. You should have a big eyes, so to you observe whatever is going on in the department, and a large head to analyze it. Don't try to just jump on the surgery. Don't expect somebody to give you surgery on the very first day, and start reading your Parsons. That must be lying on your study table. You have never opened in your third years, and Khurana say we are getting passed, or from my notes you have got passed. So please now read Parsons. That is the very first book that you have to start with. Then you have to go with your other books. Every day when you are doing some steno work, you are doing some file work of your patient, please try to open that file. See what all you are writing, what are the notes you are writing, please try to comprehend them, and also come back to your room and try to read that topic. When you will be answering the questions on the next day round, you know about the patient and you are showing interest to your patient, then definitely they will help you more and they will give you the surgery as soon as possible.
That's a very sweet answer, actually. It covers everything. So, ma'am, if a new student, for example, I won't say a new student, I would say a student who is doing the NEET PG counseling, if he has to judge a college, whether the college is good for ophthalmology or not, what are the key parameters he should keep in his mind?
Yes, so as ophthalmology, I think academics are very important. Ophthalmology is one branch that is changing entirely every 5 years. Like if I talk about Grace, that is roughly same from 100 years. But if you talk about my books, they are changing after 3 to 4 years. So any department which is giving you good academics, if you have two things, good clinical exposure and good academics, in the beginning we should always go for the good academics, because if your foundation is strong, then afterwards you can improve your clinical skills. But once your academics is low, afterwards you cannot improve it. So if you have to decide, first go for the academics, look at the patient exposure. If that is also there, then it is even a bonus for you. And number 3, you should be ready for your any sort of conferences and workshops. Any department that is doing a lot of conferences, they are promoting you for attending the workshops, is again better for you.
So, ma'am, let's talk about NEET PG as an exam now. You all know, ma'am, I think you will also know, the exam is supposed to happen in 2025. We do not have any certainty on the exam date, but we have students who are thinking about crossing that exam in the very first go. Ma'am, what would be your advice to those students? How to plan their whole strategy, their schedule, their curriculum for the NEET PG 2025 exam to actually cross it in the first attempt?
All right. So, as the date is not there, but roughly I can expect that it is not before June. So, we have 6 months in our hand. If I talk about the upcoming NEET PG examination, and so many students ask that, what, ma'am, if I start now? So, yes, if as a beginner also you are starting, you have 6 months, you can do it. Now, whatever you have studied, I think first reading of most of the students have been completed and they are planning to plan their revision. So, beta revisions at least have to be 3 to 4, and to be on the safer side, maintain your schedule for 4. I always say, shoot for the moon. Even if you miss, you land among stars. So if you plan your revision for 4, you can land up in 3, but if you plan for 3, obviously it will be insufficient. Now, how to plan your revisions? It should always be like a pyramid. Baseline has to be larger. When you are going for the upcoming revisions, lesser and lesser time, and for that, filter out the filtering out the important topics is very, very important. And here comes your one-shot revision. So if you have not made your 20th notebook, you do not know what to filter out, what is the most important thing, what we cannot afford to leave, then one-shot program is there for you. And I think all the faculties have done wonderfully well to bring out the best in the least time.
Ma'am, you have been teaching for more than 15 years now. You have interviewed so many rankers. You have mentored so many students who have not scored well also. So, ma'am, while you were talking to them, what are the 3 most common mistakes you find students who have not achieved a good rank?
First, very important thing is not giving the grand test. And for the obvious reasons, they are always afraid of giving the test because, grand test is just like a mirror and you are standing in front of you yourself and you can see how, where do you stand. So I think sooner you start, better it is. And always rankers say that I had started early, but I should have started even earlier. That is a very important thing. Number 2 is that using the multiple sources. All those people who are using the multiple sources are just making a recipe out of 4 videos. And you cannot cook anything when you are looking at the recipe of 4. So first, you should be very, very confident about your source. Once you are confident about your source, strictly you have to be restricted to that thing. And number 3, you are not doing enough practice of the MCQs. Once you have gone through the theory, most of the time students think that we have gone through this entire notes 5 times, 6 times, and we will be able to do the question. But until and unless you have that question practice, you are not able to crack it.
So, ma'am, you have interviewed so many rankers. You have actually mentored students from day 0 till they got their dream rank. Now, what were the 5 best qualities you found in a student which actually made them a 3-digit or a 2-digit ranker?
Yes. So first of all, hard work. But hard work se bhi more important is the consistency. I have seen people who were very intelligent, they did hard work, but they were not consistent. If you are not doing that daily hard work, daily piece of your studies, daily piece of your theory, daily MCQs, then obviously it won't help. Plus the maintenance of your daily schedule. If you are doing your work according to a daily schedule, you will be able to complete your required number of revisions. Otherwise, time management will obviously kill your time.
Thank you, ma'am. I mean, what would be your strategy to crack NEET PG in the very first attempt for a post-intern? A complete 1-year strategy.
All right. So you are a post-intern, so that means you have some basic knowledge of the subjects, and now we have to start with the more of the MCQ practice. So we can divide this 12 months time in 6 months, then 4 months, and then 2 months. First 6 months, I would say you have to revise, do the first reading of the subjects, give more time to the concepts. If you have already made the notes during your MBBS curriculum, then you can read those notes. And if you have not done the process of the notes making, these first 6 months, you have to invest in your notes making, because that is one thing that will actually give you a lot of confidence, lot of concepts, and they are the must for your your entrance examination. Now, once you have done with your first reading, notes making, then we can divide the next 6 months into the 4 months and 2 months. Next 4 months may you have to start doing your MCQs. So whatever subjects we have done, notes we have done, now divide your those subjects in the days 75% and 25%. Now what is 75 and what is 25 depends upon your preparation. If you are comfortable, you are confident about your theory, then invest 25% of your daily time into MCQs. If you are not very comfortable, then you can even start with the more one. Now once you have done with the first reading and second reading, slowly and gradually increase the number of MCQs, go to 50-50. Now 50% time theory, 50% time MCQs, and make sure that these MCQs are not single liners. Guys, you do not require the practice of single liners. Nowadays we have hardly any single liner, so we have more of clinical questions, and those kind of questions you were avoiding till now in your grant test, in your SWTs. Now it's a time to revise those questions. Even if you do less number of questions, quality is more important than the quantity, and reviewing that question, why I did it wrong, why is very, very important. Then look at the notes where the answer you can find and mark that area for the future review. Some questions you were not very confident, but you have done them right by fluke, so you have to mark those questions also, because this was not your final exam, and maybe in the final exam you are not that lucky. And then comes your final stage. Final stage may you have to be very concise, so make your 20th notebook from the very beginning. If you do not have the 20th notebook, we are giving you 20th notebook. Our one shot program is very, very good, effective hai. We all the faculties have put a lot of hard work and bringing our best in shortest of the time. You can utilize that. Please make sure that you are giving grant tests in the last 2 to 3 months. You have to give at least 3 to 4 grant tests in a month. That comes to every week. And I know people who have given grant tests even twice a week, even alternate day, and some of the people were giving daily grant tests in the last 10 days. The reason is that they were not demotivated by their low score. Everybody gets a low score, guys, but you don't have to get demotivated. Take it as a learning tool, and when you are analyzing your grant tests, you are reviewing them and you are working on them, then nothing can stop you from getting successful.
Thank you so much, ma'am. That was a very complete strategy, and I think covers every part a student is always worried about. Ma'am, let's talk about ophthalmology as a branch, but for the future. Ma'am, and as a super specialty branch also. Ma'am, you have named all the super specialty branches in the previous answer. Ma'am, how would you rank them? From 1 to 5, how would you rank all the super specialties possible in ophthalmology?
All right, so at the top we have the retina. Like, as we are getting richer, we are getting more of rich man's disease, diabetes and hypertension, and that is why lasers are, the absolute cream when we are going for the super specialties for diabetic retinopathy, hypertension, retinopathy. Next comes your refractive surgeries, because nobody wants to wear the specs, and everybody wants to go for the LASIK, so that is there. Then we have the glaucoma clinics, because it is a irreversible vision loss. People are getting more aware. So all those people who have the family histories are also coming to you. Glaucoma clinics are running well. Cataract will always remain evergreen. We have the cataracts. And last but not least is the cornea clinics. Cornea clinics are actually not, they are not worth coming on the number 5. But the thing is, the prognosis is not as good, is the most important refractive surface. So once you get the opacity over the cornea, the visual prognosis is not that good, though we have eye banking there. But again, though, cornea is the most important and most successful organ transplantation, but still we do not have very, very good success rates, and we have so many of grafts rejection. That is why I have kept cornea at number 5.
Ma'am, where do you see ophthalmology going in next 10 years? Like, which super specialty would be most in demand in upcoming 10 years?
Yeah, so and as the upcoming years, I think we will have more and more cases of diabetes and hypertension, and lasers will become even more, higher ranking as it is, because earlier we used to go outside for the treatments, but now we have good lasers, and as we are getting more and more advancement in the quality of the lasers, precision of the microscopes, I think that would go even more higher. Second is the refractive surgeries. I am not able to see any person in the future who is actually wearing the spectacles. One of the very common questions that I answer even after my classes, every of my student wants to go undergo the refractive surgery. So I tell them that if you as a doctor don't want to wear the specs, how can we motivate the others to wear the spectacles? So these two obviously will be taking a very high place in the future 10 years.
And what would be the role of AI in next 10 years?
Yeah, so AI in ophthalmology, like any other brands, we will be having, I think, AI, and I can see that even the cataract surgeries being performed by AI, because we have a limited field where we are working. So AI is already there in ophthalmology. It is the most technical branch, and we have more than 365 procedures. If we are doing one procedure in a day, I cannot complete in the entire year. So AI is almost everywhere, and we have so many places in ophthalmology where AI is already there. And I fear that we will have the AI doing the cataract surgeries also one day. Laser can definitely be done by them. We can reinsert the values, the precise areas. They can go, they can do the lasers. That is a one-shot procedures. And last is your cataract surgeries if they are being done by it.
And do you see any failure rate in the field of ophthalmology? Like, do you see failed ophthalmologists around you? And if there are any, what are the reasons that they became a failed ophthalmologist?
So I cannot see anything like failed ophthalmologist. I would say that if you have become an ophthalmologist, you are already successful.
That's a great answer, ma'am. Ma'am, this might be a little bit of a controversial question, but I will still ask that. Do you feel that in today's time, students actually perceive a faculty by their social media stature rather than the content? Do you feel so?
Yes, it's true. Students actually follow the faculties according to their social media influence. But I would say that that is directly proportional to their content. If a faculty is not having the enough content, he or she won't be coming on the social medias. And it's other way around also. If you are coming, if you have that desire and you are daring to come on the social media, obviously you have to be updated. See, coming on the social media, taking lives on daily basis does not mean only imparting your time. It means your energy and your daily studying by yourself also. If I am telling anything on social media, first I have to be 100% confident about it. I have tested it from so many places. I am first studying it by myself and then only asking my students. So it's very less that faculty who is not very good at content is coming and taking the social media lectures.
We have actually come to the end of our conversation, but this is not the end. We will now move to the rapid fire round. And the rapid fire round just has two simple rules. One, you have to be super truthful with us. And second, you have to be super spontaneous. So no changing of answer and no thinking about the answer.
Okay.
Sama, are you ready now?
Yes.
Great. So question number one. How much money does Dr. Neha require to retire this very second?
Any amount of money cannot make me retire.
Acha.
Yes, I will not retire due to money. I will retire when I think that I am not able to impart that knowledge that my students require.
Okay. So what's your favorite thing about being a doctor and an educator?
That spark in my students' eyes and my patients when I'm treating them, when I'm motivating them.
If not a doctor, what profession would you have been?
I could be an interior designer. I could be a fashionist, winning so many Beauty with Brains awards in my college.
Are you a beach person or a mountain person?
Beach.
Where did you go on your last vacation?
China, Hong Kong,
And what's your favorite vacation destination?
Switzerland,
Books or Netflix?
Netflix.
Cars?
Yes.
Happiest moment in Dr. Neha's life?
When I got my son telling that I am the best mother of the world, that was the
Kya baat.
best.
So thank you so much, ma'am. With this, we come to the end of our conversation, end of our podcast. Thank you so much. You have literally untangled complete ophthalmology for us. And I don't think any question has been left in the viewer's mind कि ophthalmology के बारे में जो भी जानना था मैम ने सब बता दिया है. Thank you so much.
So thank you, and I would end with happy ophthalmology.
So guys, I hope you have got the sparkle in your eyes now. Everything you need to know about ophthalmology has been discussed here, to the extent of going from how much an ophthalmologist earns to what are the opportunities as a super specialties in the upcoming 10 years. So we have covered everything. So thank you so much for listening to the podcast. Who do you want to be the next guest on our hot seat? Please put it in the comment section. And again, if there's any feedback, do not forget to mention that too. And if you have not subscribed to the channel, please do subscribe it before sharing it with your friends. Thank you so much and all the best.